Accidental deaths are the fourth leading cause of death in the United States. Every year, over 146,000 people die due to accidents. There are over 30 million emergency room visits for unintentional injuries each year. Nearly 32,000 die from unintentional falls. Over 33,000 die due to motor vehicle accidents. And a whopping 42,000 die from unintentional poisoning. There are over 5 million accident-related deaths worldwide per year. We're going to be switching things up a little bit in this episode. You may be wondering, how in the world can H2 help with accidents? Obviously, there's some accidents like immediate deaths that probably won't be benefited by hydrogen. But you may be surprised at the evidence we compile for the potential of hydrogen for the overall topic. Put your seatbelt on because it's time to learn. According to the CDC, accidental injuries tops the list as the leading cause of death in the U.S. for people under 44 years of age. This statistic does not include deaths from complications of injuries such as sepsis, so this statistic may be higher than calculated by the CDC. Accidental injuries can be organized into general groups to include hemorrhage, crush injuries, blunt force trauma, burn injuries, bone fracture, chemical injury, radiation injury, and combination injuries such as trauma with hemorrhage or radiation with combined trauma. It is not challenging to pair the above-mentioned type of injury with traumatic scenarios such as motor vehicle accidents, earthquakes, fires, explosions, shootings, stabbings, major surgeries, and radionuclear accident or events. An unintentional injury is a significant accident or injury that causes damage to the human body, which may lead to a hospital visit and or death. Immediate deaths caused by car accidents are primarily the result of injury to the brain, spinal cord, heart, or major blood vessels. According to this, traumatic injuries induce a complex host response that disrupts immune system homeostasis and predisposes patients to opportunistic infections and inflammatory complications. Trauma is one of the leading causes of death worldwide. Even though around 53% of the trauma-related deaths occur at the scene of the accident, over 7% occur at the ER and over 39% at the hospital. Patients who survive the early period after the accident may suffer death and complications in later treatment phases. Given that information, I would say there's room to make a difference in the outcome, wouldn't you? We broke this topic down into different types of injuries or complications and how H2 may help. Let's start with the first one. Wound injuries. The wound healing process of your body works to restore the integrity and function of the injured tissue. However, wound progression may result in hypertrophic scarring, wound contractures, infections, sepsis, and death without appropriate interventions. Okay, so let's see what hydrogen can do here. Here we see that hydrogen was able to diminish ROS generation induced by physical injury and promote wound healing. And here we see that hydrogen was able to reduce the wound size and promote early recovery. In this study, hydrogen water was able to exhibit multiple beneficial effects on wounds, like accelerating the wound healing process and enhancing the expression of healing-associated genes. Overall, the results of the study were that hydrogen water would be beneficial during the wound healing process by decreasing oxidative stress and inflammatory response. The next type of injuries to discuss is burn injuries. To start, let's look at this study on early burn wound progression. So when burn wounds progress, it can result in more severe consequences, such as slow healing wounds, systemic inflammation, local infection, and even sepsis. And that can lead to poor prognosis and higher risk of mortality. Let's see the results. The results indicate that the hydrogen administration significantly attenuates the oxidative stress during the early stages in burn wounds by inhibiting membrane lipid peroxidation and enhancing the activity of endogenous antioxidant enzyme systems. In addition, hydrogen treatment markedly inhibited apoptosis and autophagy in the interspace wound tissue after burns. Furthermore, hydrogen applications also remarkably decreased protein expressions of pro-inflammatory cytokines and upregulated protein expression of the anti-inflammatory cytokines. So what does all this mean? Basically, H2 can potentially have a beneficial effect on burn wounds by regulating inflammation, reducing oxidative stress, and preventing cell death. Now, cell death or apoptosis is important for this reason. Apoptosis has been shown to be involved in wound progression, exacerbating local ischemic damage and necrosis. The data indicates similarly marked activation of apoptosis in wound tissue after burns. It has also been reported that relieving apoptosis can decrease tissue loss and promote burn wound healing. And they found that the antioxidant property of hydrogen may influence tissue apoptosis. Overall, the results indicate that hydrogen is a potential therapy to prevent wound deepening and extension in early stages of burn wounds. Further research also confirms the benefits of H2 for burns. This study also examines the effects of acute kidney injury from severe burns. Acute kidney injury is a devastating complication that affects patients exposed to severe burn injuries. This kidney injury from severe burns has a high mortality rate from 50 to 100%. In our study, hydrogen exhibited a strong ability to attenuate severe burn-induced oxidative stress damage to renal tissue by scavenging free radicals and upregulating endogenous antioxidant enzyme activities. To summarize, H2 has the potential to protect against acute kidney injury following severe burn injuries. This appears to be a result of its ability to relieve oxidative stress, inflammation, and cell death. It's worth noting the study mentioned in the last video about hydrogen protecting the lungs from smoke inhalation injury. Go check that out, and we will also link the study in the description. Another common complication from accidents is internal injuries and organ damage. While treatment is usually directed towards more obvious injuries, the cause of death often can be attributed to more covert and internal injuries. Many times, the initial injury promotes a pro-inflammatory response, which is exaggerated and may cause organ injury and multiple organ failure. According to this, hydrogen may have a protective effect on oxidative stress-induced organ damage. We see here that hydrogen showed to be protective to the kidneys, intestines, lungs, heart, and eyes. And here it also showed benefit to the brain and liver as well. Here it says that molecular hydrogen was considered as a useful method to alleviate structural damage of kidneys, protect renal function, and resist inflammatory and oxidative reaction. Hydrogen was even able to promote liver regeneration. Speaking of specific organs, the next topic is traumatic brain injury. Traumatic brain injury is a major problem for modern society. It arises from a variety of injuries, with car accidents and falls being the most common. Acute TBI can transform into a chronic condition and can be a risk factor for neurodegenerative diseases like Alzheimer's and Parkinson's disease. Consequences of TBI is decreased survival rate, increased blood-brain barrier permeability, brain edema, and neurological dysfunction. Inflammation and oxidative stress causes apoptosis after a TBI. Likewise, neuroinflammation is thought to be a primary driver of long-term pathology resulting from TBI. Traumatic brain injury can even predispose a patient to develop sepsis, which we'll talk more about later. Once set in motion, these processes often become self-reinforcing unless the cycle can be disrupted. Thus, preventative and interventive therapeutics are needed to treat TBI as early as possible. And here's where H2 comes in. According to this, H2 treatment ameliorated the consequences of TBI. Here it says TBI results in long-term injuries to the central nervous system that involves immediate effects such as brain edema and more sustained effects such as neural inflammation. Here we found that many of the immediate and sustained effects were modulated by treating with hydrogen. In fact, H2 should have unrestricted access to the central nervous system, which is a huge benefit for TBI. According to this, H2 actually diminished the disruption of the blood-brain barrier. Here it says hydrogen may play a therapeutic role in the recovery from TBI. This study concluded that H2 may be an effective therapeutic strategy for patients with cognitive deficit after TBIs. And here it suggests that H2 water protects against neurodegenerative changes induced by TBIs. In conclusion, hydrogen-rich water could exert a neuroprotective effect against TBI and attenuate inflammation, which suggests hydrogen water as an effective therapeutic strategy for TBI patients. And finally, we end the topic with this study. Overall, these studies provide proof of principle that hydrogen water can potentially reverse, block, or attenuate many of the effects of the brain injury. These include effects on edema formation, regulators of blood-brain barrier function, neuroinflammation, and gene expression. This suggests that hydrogen water could be an important non-toxic treatment for acute traumatic brain injury. Because of its non-toxicity and ease of administration, hydrogen water could be readily adapted for clinical, emergency, and even first responder use. Yeah, that's pretty huge. The next one is a big time injury and accidents as well. Spinal injuries. This study confirms that hydrogen treatment within the first 2 weeks of the injury effectively contributes to the repair of the spinal cord in the acute stages. The data suggests that hydrogen alleviates spinal cord injury. It goes on to indicate that hydrogen is a promising potential treatment for spinal cord injury and other diseases associated with oxidative damage, inflammation, and apoptosis. It is also reported here that administration of hydrogen reduced spinal cord contusion injury by decreasing the number of apoptotic cells, suppressing oxidative stress, increasing the release of brain-derived neurotrophic factor, and improving locomotor function. And here, H2 treatment reduced motor neuron cell death in the spinal cord. They concluded that H2 treatment may be an effective therapeutic strategy for spinal cord ischemia reperfusion damage. The next complication for accidents to discuss is hemorrhage or blood loss. Atonial hemorrhage has been associated with the primary cause of death in multiple injuries. Approximately 30% of the deaths caused by trauma is due to hemorrhagic shock. Hemorrhagic shock is a life-threatening condition where you lose more than 20% of your blood supply. This study even suggests that early death occurs between 30 minutes to 3 hours after injury, often resulting from major internal hemorrhage or severe blood loss. However, it was proposed that early medical intervention could have saved many of these patients. With that being said, here we see that hydrogen water could ameliorate hidden blood loss by reducing oxidative stress. And here it said hydrogen had a protective effect on the blood-brain barrier after a brain hemorrhage. But this study looks at intestinal injury after hemorrhagic shock. It says uncontrolled hemorrhagic shock causes body's low blood capacity and low perfusion of visceral organs. Limited blood supply mainly maintains brain, heart, and kidney function, leaving intestinal blood supply largely decreased. This makes the intestine a primary injury target after uncontrolled hemorrhagic shock. These results suggest that hydrogen-rich solution can decrease pro-inflammatory cytokines and increase anti-pro-inflammatory cytokines, which could protect against intestinal ischemia reperfusion injury after hemorrhagic shock. According to this, abundant evidence showed that hydrogen had an anti-inflammatory effect and could protect brain, lung, heart, and pancreas following a hemorrhagic shock. Next is a complication that is very serious and a source of much research. Sepsis represents a major challenge in medicine. It begins as a systemic response to infection. It can affect virtually any organ system. It's one of the most serious diseases in the ICU. Severe sepsis affects 750,000 people per year. The incidence of post-traumatic sepsis has actually decreased in the past 2 decades and is at 2 to 10%. However, of the 2 to 10%, there is a 23% mortality rate. Injury severity, mechanism of injury, number of injuries, and other injury characteristics are factors associated with post-traumatic sepsis. Okay, so sepsis is a pretty big deal and pretty scary if you ask me. Here it says hydrogen had a protective effect on sepsis. 2% H2 inhalation treatment was effective at attenuating sepsis-induced lung injury. And here we see hydrogen therapy protected the intestines from sepsis. Sepsis can destroy the structure of the brain through stimulating an oxidative stress reaction and inflammatory response, which leads to impairment of cognition. However, molecular hydrogen therapy was proved to attenuate the disruption. In conclusion, molecular hydrogen therapy is a promising method to alleviate organ damage, improve outcome, and reduce mortality rate in sepsis. The next accidental injury to talk about is poisoning. For this topic, we're going to focus on carbon monoxide poisoning. An increase in ROS is crucial in the pathogenesis of carbon monoxide poisoning. They found hydrogen provides neuroprotection against acute carbon monoxide poisoning. Hydrogen therapy may be an effective, simple, economic, and novel strategy in the treatment of acute carbon monoxide poisoning. And here, hydrogen showed the potential as a treatment for patients with severe carbon monoxide poisoning. And finally, hydrogen has the potential as a novel and alternative therapy for severely carbon monoxide poisoned patients due to its antioxidant and anti-inflammatory actions. The next topic is one that has rising mortality rates every year. That is, of course, accidental overdoses. First, let's look at the information on the misuse of common over-the-counter medicines. Analgesics were the most common category of drugs in acute overdose in adult patients, and the second most common in pediatric patients. Aspirin is widely used as an anti-inflammatory and pain reliever. It often induces gastrointestinal adverse effects, which limits its clinical use. It can have adverse effects even if it's used at low or safe doses. Despite its decreasing incidence, aspirin poisoning remains an important clinical problem involving accidental ingestion in children and intentional overdose in adults. Even though aspirin overdose nowadays is not as common, it continues to contribute to significant morbidity and mortality. NSAIDs are non-steroidal anti-inflammatory drugs, which includes ibuprofen. Side effects are usually not life-threatening unless more than 400 milligrams are ingested. Severe poisoning and death as a result of NSAID acute overdose is extremely uncommon. However, there are reports of liver, kidney, and gastrointestinal problems with acute NSAID overdose. Neurological side effects have also been reported, like drowsiness, confusion, blurred vision, or headaches. Although acetaminophen has a safer gastrointestinal profile than NSAIDs, there are probably more deaths from acetaminophen than ibuprofen. Acetaminophen overdose can cause fatal hepatotoxicity. Okay, on to the H2. Here, hydrogen alleviates aspirin-induced gastric lesions by inhibiting oxidative stress and inflammatory reaction. This may provide a potential therapy for the adverse effects of aspirin. Here it says that hydrogen has significant therapeutic potential in acetaminophen-induced hepatotoxicity by inhibiting oxidative stress and inflammation and promoting liver regeneration. Here we see hydrogen may be safe and effective in the prevention of stomach injury due to NSAIDs. And finally, here it says hydrogen therapy can reduce many kinds of cell damage due to drugs and chemicals. Now for the more severe issue concerning overdose. More than 115 Americans die every day from opioid overdose. According to the National Institute on Drug Abuse, the misuse of and addiction to opioids is a serious national crisis that affects public health as well as social and economic welfare. It is estimated that the total economic burden of prescription opioid misuse alone in the U.S. is $78.5 billion a year, including the costs of healthcare, lost productivity, addiction treatment, and criminal justice involvement. Roughly 21 to 29% of patients prescribed opioids for chronic pain misuse them, and between 8 to 12% of them develop an opioid use disorder. Now, this is an issue that needs more research, but there is some promising evidence that H2 could be very beneficial for this epidemic. This interesting study even states that hydrogen may reverse opioid-induced hyperalgesia. Hyperalgesia is a condition where a person taking opioids for pain treatment could actually become more sensitive to certain pain stimuli. The condition usually develops in response to chronic and acute opioid exposure. And obviously, this condition leads to even more of an increase in opioid usage, which in turn can lead to higher risk of accidental overdose. Another benefit of H2 for overdose can be assumed by the next and last topic: pain. The reason we take painkillers. Chronic pain is a state where abnormalities are maintained in the central and peripheral nervous system. ROS is often associated with persistent pain, such as neuropathic and inflammatory pain. There is a whole lot we can assume about the effects H2 has on pain. We can point out all the genes and enzymes that play a factor in pain and then show how H2 regulates those things. For example, this study on this particular protein says it induces a variety of intracellular responses associated with neuropathic pain and other chronic pain. Thus, specifically targeting this molecule and its signaling pathways represents potential therapeutic strategies for pain management. But we see in this study, hydrogen was able to decrease the expression of this particular protein. And there's more where that came from. But we'll save that for a specific video on pain. But until then, we'll leave you with these quotes about H2 and pain. This study showed that hydrogen significantly reduced the behavior signs of hyperalgesia and allodynia. Allodynia is the pain sensation following normally non-painful stimulation. Here it says hydrogen produced a pain-relieving effect on the model of neuropathic pain. Pre-treatment with hydrogen delayed the development of pain behavior as well. And finally, we see here that hydrogen is a potentially promising prospect for clinical treatment of neuropathic pain. The topic of pain is beneficial for discussing accidental injuries for two reasons. One, because pain reduction is needed after many injuries. And two, if you can reduce the pain in a safe and effective way, You can decrease the risk of pain reliever dependency and abuse. And H2 just may possibly help with both of those reasons. If you can imagine a country where everyone drank hydrogen water, what could that look like for the outcome of accidents? Okay, so was there an accident I didn't talk about that you would want to know about? Let me know in the comments and I will try to respond with my answer. We will see you in 2 weeks with our next episode on strokes. Make sure that you share this video and subscribe to our channel. And